My name is Iris Fong, and I'm a student pharmacist. I'm presenting for Group 12 today. We have a patient, 73-year-old HG, who came to the pharmacy feeling anxious, short of breath, and in constant need for his rescue inhaler. He said the symptoms started yesterday after he took a walk with his wife. This morning, he woke up with a headache. He had trouble breathing, and before he came in, he had a nosebleed. We asked the patient about his medical history. He said he was diagnosed with asthma about 8 years ago, and 6 months ago, he started using the Advair Diskus. He said his asthma has been under control and he would only need his rescue inhaler once or twice a month after strenuous exercise. However, he did not tell us what strenuous means in his circumstances. We didn't ask him to clarify either. We would ask more questions later, perhaps. HG's family has some problems with hypertension and heart disease. HG's father died of heart failure at age 65. His mother was hypertensive and diabetic, and she died at age 72. HG himself is hypertensive, but he didn't bring that up during the medical history review. We looked that up when we saw that he had a prescription for lisinopril. We asked him about his social history as well. HG stated that he never smoked and he only drinks 1 beer a week every Saturday at the Elks Club. We understand that such establishments could have a second smoke problem. It's possible that he was exposed to second smoke, but we didn't ask him to elaborate whether he has such experience. He does not drink coffee, and he did not give us any information on the use of illicit drugs. We asked him about allergies. HG said he's allergic to his inhaler. He's currently on 3 medications. His albuterol rescue inhaler is to inhale 1 to 2 puffs every 4 to 6 hours as needed. And he's using the Advair Diskus, is used 1 puff twice a day, and the lisinopril 10 milligram tablet is to be taken by mouth once a day. We took some vitals for HG. We noticed that his blood pressure was very, very high at 190 over 122. He's suffering from tachycardia. His heartbeat was 100 per minute, and his respiratory rate was 30 per minute, and his temperature is slightly elevated at 99 degrees Fahrenheit. Our assessment is, we believe he is experiencing some kind of serious cardiovascular event. His mild chest pain and the tachycardia and extreme hypertension all place him at a high risk for cardiovascular and cerebrovascular problems. He could have a stroke, he could have a myocardial infarction. As he had a first-degree relative dying of cardiovascular disease, it makes him more likely to have the problem as well. So he has to be referred to a physician for possible evaluation and treatment of these concerns. His chest pain, his shortness of breath, his headache, and his feelings of anxiety may all indicate a current cerebrovascular or cardiovascular event. The tachycardia and hypertension may be due to the overuse of his rescue inhaler. It caused overstimulation of his adrenergic receptors. Secondly, definitely his blood pressure is not under control on the current dosage. Although in principle, it's better that we wait a few minutes, sit him down, and then take another reading of his blood pressure. But we also suspect that since he did not bring up the hypertension, maybe he's not adherent to current medication. Or perhaps he requires additional therapy. His elevated blood pressure of 190 over 122 greatly increases his risk of stroke. The nosebleed and headache are also indication of hypertension. Again, the high blood pressure, we couldn't emphasize more that is likely to be the result of overstimulation of the adrenergic receptors. Of course, there's also a possibility that it can be due to undiagnosed cardiovascular disease, but we cannot diagnose that here. It has to go through certain lab testing and blood pressure monitoring. The patient stated that he could be allergic to his inhaler, but we believe this is extremely unlikely because he did not show other symptoms of allergy and because he had been using the Advair successfully for 6 months. He also stated that these symptoms only started about a day ago after his walk with his wife. It's possible that he was exposed to some kind of allergen on his walk, but again, he doesn't present other symptoms such as nasal congestion, itchy eyes, sneezing, and so we don't believe allergy was a factor here. Most likely, the walk exacerbated his asthma, and he might also have some kind of minor infection in the upper respiratory tract. We noticed a white lesion in the back of his throat, and HGD mentioned that he's suffering from some kind of dry hacking cough and mouth pain. We suspect the white lesion could be an infection of Candidus and is a common side effect when you use inhaling corticosteroid long term. Your immune system is suppressed. So the side effect is it may encourage fungal growth in the vocal cavity. It's oral cavity. And it's also possible that HG was not following his Advair use guideline, which is supposed to be rinsing his mouth after every puff. Lastly, his blood pressure, cough, wheezing, low-grade fever could be indication of infection in combination with his asthma. Of course, the dry hacking cough could also be the lisinopril or the Advair, since both medication could have a side effect that causes coughing. Our plan is to advise him to seek immediate medical attention for his blood pressure, his breathing problem, his chest pain, since he can be at risk for myocardial infarction and a cerebrovascular accident. We believe that alternative therapy may be needed or a dosage adjustment may be warranted. If his dry hacking cough persists, perhaps we should have his physician follow up on the situation, and perhaps a change of medication is warranted as well. He may also need an alternative to the Advair Diskus because of increased risk of oral and respiratory infections. Suppose his description is correct that his asthma has been under control over the past months. Maybe his doctor can taper the treatment down and incorporate a replacement or complement like montelukast, which could work with the fast-acting bronchodilator to manage his asthma. He should follow up with his physician concerning the white lesion, just to make sure whether it's fungal or bacterial. If it's fungal, many antifungal medicine would interact with the Advair. So we need to watch out for that, perhaps make some adjustment as well. If the lesion is caused by a bacterial infection, he will need antibiotic therapy. As part of patient education, we believe HG should watch out for other adverse effects of chronic corticosteroid use. It could cause side effects such as glaucoma and osteoporosis. And just as a precaution, he should have his eyes examined every 6 to 12 months, and he should have his bone mineral density monitored. Finally, HG should consult his doctor about setting up an asthma diary. So we have a daily log of his peak expiratory flow, his symptoms, and maybe his triggers and other factors. This way, we can better evaluate how effective the therapy regime has been and adjust it properly. This concludes our evaluation of HG's case. Thank you very much.